The landscape of mental health treatment has changed dramatically since the 1950s. The introduction of the first antidepressants, like imipramine, marked a turning point. The 1980s brought about selective serotonin reuptake inhibitors, or SSRIs, like fluoxetine, also known as Prozac. SSRIs revolutionized treatment with their improved safety profile. They primarily target neurotransmitters like serotonin, norepinephrine, and dopamine. The search for more effective medications with fewer side effects continues. Therapy, lifestyle changes, and social support are crucial for long-term well-being. Addiction and mental illness often go hand in hand. Many individuals struggling with conditions like depression, anxiety, and PTSD also battle substance abuse. This connection is complex and multifaceted. Mental illness can increase the risk of addiction, as individuals may turn to drugs or alcohol to self-medicate and cope with their symptoms. The reverse is also true. Substance abuse can worsen mental health conditions or even trigger the onset of new ones. The chemical imbalances caused by drugs and alcohol disrupt brain function, impacting mood, behavior, and overall well-being. This vicious cycle can be challenging to break. Addressing both addiction and mental illness simultaneously is crucial for successful treatment. Integrated treatment programs that address both issues are essential. These programs provide comprehensive care, including therapy, medication management, and support groups. Understanding the interplay between addiction and mental illness is vital for reducing stigma and improving access to effective treatment. Breaking down these barriers is essential for helping individuals reclaim their lives and achieve lasting recovery. The use of intoxicants in treating mental illness is a topic of ongoing debate. While some substances like ketamine and psilocybin have shown promise in treating conditions like severe depression and PTSD, their use remains controversial. Ketamine, an anesthetic, has demonstrated rapid antidepressant effects in some studies. Psilocybin, the psychoactive compound in magic mushrooms, has been explored for its potential to alleviate end-of-life anxiety and treat addiction. However, these substances also carry risks. Ketamine can be addictive and has dissociative effects, while psilocybin can induce anxiety and paranoia in some individuals. The use of these substances in a controlled medical setting, with careful patient selection and monitoring, is crucial to mitigate risks. Rigorous research is ongoing to determine the long-term efficacy and safety of these treatments. The potential of these substances to revolutionize mental health treatment is undeniable. However, their use requires a cautious and ethical approach to ensure patient safety and maximize therapeutic benefits. The future of mental health treatment may involve a paradigm shift, where certain intoxicants, used responsibly, play a role in healing and recovery. The field of psychiatry is constantly evolving, with new medications emerging to address mental illness. Antipsychotics, initially for schizophrenia, now manage bipolar disorder and treatment-resistant depression. Atypical antipsychotics, like risperidone and olanzapine, have fewer side effects. Resilience enhancers aim to strengthen coping with stress. Early research shows promise for preventing mental health conditions. Neuropeptide Y nasal spray may help with stress resilience. Advancing brain understanding leads to better mental illness treatments. Stress. The silent epidemic. Stress, an unavoidable part of life, has become a silent epidemic. It's the body's natural response to challenges, triggering physiological changes. Hormones like cortisol and adrenaline prepare us to fight or flee. Short-term stress sharpens focus, but chronic stress harms health. Chronic stress leads to elevated blood pressure, heart disease, and weakened immunity. It also causes anxiety, depression, and sleep disturbances. Managing stress is crucial for good health. Techniques like exercise, mindfulness, and deep breathing promote relaxation. Section 6. The pandemic's impact on mental well-being. The COVID-19 pandemic has had a profound impact on mental health globally. The unprecedented challenges of lockdowns, social isolation, economic uncertainty, and fear of illness have taken a toll on individuals and communities worldwide. Rates of anxiety, depression, substance abuse, and suicidal ideation have surged since the pandemic's onset. The disruption to daily routines, social support systems, and access to healthcare exacerbated existing mental health conditions and created new challenges. Frontline workers, essential workers, and those who contracted the virus faced unique stresses that further impacted their mental well-being. The pandemic highlighted the importance of mental health awareness and the need for accessible and affordable mental health services. Telehealth emerged as a vital tool for delivering mental health care remotely, bridging the gap for many who faced barriers to in-person care. The long-term mental health consequences of the pandemic are still unfolding. Addressing the pandemic's impact on mental well-being requires a multifaceted approach, including increased funding for mental health services, reducing stigma, and promoting mental health literacy. Section 7. Navigating the complexities of mental health and addiction. The intersection of mental health and addiction presents complex challenges for individuals and healthcare systems alike. Many individuals with mental health conditions turn to drugs or alcohol as a way to cope with their symptoms, leading to a vicious cycle that can be difficult to break. Substance abuse can exacerbate mental health symptoms, making it harder to manage both conditions effectively. The stigma surrounding both mental illness and addiction often prevents individuals from seeking help, further compounding the problem. Addressing this complex issue requires a comprehensive and compassionate approach. Integrated treatment programs that address both mental health and addiction simultaneously are crucial. These programs provide a holistic approach, offering therapy, medication management, and support groups tailored to the individual's needs. Breaking down stigma, increasing access to affordable treatment, and promoting early intervention are essential for improving outcomes for individuals struggling with both mental health and addiction. Section 8. Modern approaches to treatment. Modern approaches to mental health treatment have evolved significantly. Personalized medicine, tailored to an individual's genetic makeup, is gaining traction. Technology is playing an increasingly important role in mental health care. Telehealth has expanded access to care. The future of mental health treatment lies in a holistic and integrated approach. Section 9. Towards a mentally healthier future. Achieving population-level mental health requires a collective effort from individuals, communities, and policymakers. Reducing stigma surrounding mental illness is crucial. Open conversations about mental health, challenging misconceptions, and promoting understanding can create a more supportive and inclusive environment. Early intervention and prevention programs are essential. Teaching children and adolescents about mental health, coping skills, and resilience can help build a foundation for lifelong well-being. Investing in mental health research is vital for developing new and more effective treatments, understanding the underlying causes of mental illness, and improving prevention strategies. Access to affordable and quality mental health care is a fundamental human right. Expanding insurance coverage for mental health services, supporting community mental health centers, and training more mental health professionals can help bridge the gap in care. Creating a mentally healthier future requires a commitment to prioritizing mental well-being, fostering resilience, and ensuring that everyone has the support they need to thrive.